I would
Thank
now
you.
like to welcome Natalie Perez Mendez from Poznan Medical School in Poland, who will be speaking about uncommon consequences of SARS-CoV-2 on the nervous system.
Good morning. Can you guys see my screen?
Yes, we can. Please proceed. Thanks.
Okay, great. Thank you. Good morning, good afternoon, and good evening to all of you joining around the world in today's session. I'm honored to be presenting at the VSI conference today. My name is Natalie Perez Mendez. I'm a medical student at Poznan University Medical Sciences, and my co-author is Dr. Martha Rodriguez, internist and president of MMR Healthcare. Our presentation is entitled Uncommon Consequences of SARS-CoV-2 on the Nervous System. This is a case of a 52-year-old female presenting to our outpatient private internal medicine practice with no prior history of a nervous system pathology. Her first visit with us was a televisit in May 2020, where she had evidence of a severe respiratory infection. She had a PCR test shortly before the televisit, and it ultimately came back positive for SARS-CoV-2. The doctor decided to begin with 1 week of oral prednisone, which was titrated down. Unfortunately, the patient's symptoms persisted and were quite severe. So the doctor decided to begin dexamethasone 4 milligrams IM injection daily for 2 weeks. And because of the severity of the respiratory distress, we added supplemental high flow oxygen of 2 liters continuously for this patient. It took 8 weeks for her to continue using this oxygen and a lot of steroids, like I mentioned, but fortunately, the patient never had to go to the hospital. She was managed in the outpatient setting. But however, 2 months later, she had an office visit in July. And by this point, she had already tested negative twice of the virus. However, she was complaining of severe muscle aches, sciatica-like pain radiating down both lower extremities, nerve impingement pain starting at the neck and radiating down to both upper extremities, intermittent amnesia, chronic fatigue, and hair loss. This pain was refractory to NSAIDs and topical diclofenac. Instead of proceeding to stronger pain medications, the doctor decided perhaps let's try cyanocobalamin intramuscular injection or vitamin B12. And that did work for the patient. Her symptoms nearly 100% resolved. However, the patient left the office, and a few days later, she was complaining of the same near crippling muscle aches and sciatica-like pain and nerve impingement pain of the upper extremities. The doctor gave her another B12 shot, and ultimately that resolved the symptoms once again. And she continued like this. So ultimately, we determined that this patient is probably suffering from long-term sequelae of the COVID-19 infection. As of January 2021, despite having fully recovered from the respiratory infection, she still suffers from radiculopathy-like pain, dermatitis, amnesia, and alopecia, despite having no other apparent medical conditions that could be playing a role, such as anemia, autoimmune disorders, or extreme stress. These pictures of the rash with the wheals that appear on her back and upper extremities and neck, right here, yeah. And we found that the patient is only infected by these symptoms when she goes more than a few days without the B12 injection. The only symptoms that have not improved from the B12 therapy are the intermittent amnesia and alopecia. This patient describes amnesia as overall forgetfulness of things that she used to know very well. Like, for example, she volunteers at her local church and she used to know the attendees' names very well and their backgrounds. But ever since the COVID infection, she regularly forgets these people's names or backgrounds that she otherwise would have known without thinking about it too much. There's like this general forgetfulness and loss of acuity in her thoughts that still persists up until just recently on our last visit of last month. I do not have a picture of her head, but her hair loss is quite significant and is affecting the front of the scalp the most, and it's progressively getting worse over time. Lastly, for her COVID infection, but we did lab results from April 2018 that shows she was not B12 deficient. So that was an interesting component in this patient. Her most recent blood work from November 2020 shows that she has plenty of B12, which is expected as she's getting much more than her body needs, especially according to the standard lab value range. Um, there is evidence to support that the virus does invade the nervous system. This graphic illustrates neuronal injury associated with SARS-CoV-2 infection, whether the virus takes the path via the olfactory pathway or by crossing the blood-brain barrier directly. It appears to trigger a cytokine-mediated destruction cascade that is most likely playing a role in our patient and in many others like her, and unfortunately causing long-lasting consequences. We know this concept of COVID long haulers, seems to be affecting our patient and is a problem that is going to continue to face the healthcare industry because a significant portion of the population that gets infected with this virus is reporting symptoms lasting weeks, even months since first getting infected. With this slide, I wanted to just highlight that this topic has received a lot of attention, not only in the media, but also has generated a lot of literature being published regarding the COVID-19 infections, with a significant portion of it illuminating neurological consequences. Although we're a year into the pandemic, we still have much to learn about the novel virus. I'll conclude with the primary takeaway from this case and some questions we think are important to find the answers to. Nervous system consequences are generally overlooked when managing patients with COVID-19. In addition to assessing the respiratory capacity in a patient first presenting with a possible COVID infection, we think it's important to obtain a baseline neurological examination, since it is likely that the virus can attack the nervous system and cause lasting detrimental consequences. Then it's critical to continue to keep the nervous system in mind, along with the respiratory system, obviously, during the continuity of care of these patients. We must also ask if the severity of SARS-CoV-2 infection correlates whether or not you'll have neurological consequences or how severe these consequences may be. Our patient was absolutely in terrible shape. This had her out of work and bedbound about 8 weeks. There are ongoing there are ongoing discussions about the relationship between viral load and transmissibility, and viral load and severity of respiratory symptoms. But we think it's worth investigating if there is a relationship between viral load and neurological complications. This answer can also guide decisions about therapeutics and timing of therapeutics for the future. Secondly, can regular B12 injections be a viable therapeutic for patients suffering a similar COVID sequela like our patient? The upside is that it's relatively cheap, it's readily available, and a water-soluble vitamin that can be administered easily in the outpatient setting. At least for my home state of Florida in the United States, a lot of the policy being put into action regarding how to deal with this pandemic has been guided by data from hospitalizations because of how expensive it is to care for hospitalized patients, and because, of course, risk of morbidity and mortality increases as a hospitalized patient. Therefore, focusing on our efforts on the outpatient therapeutics has positive medical and political advantages. We must also ask if the placebo effect is at play here with this patient. We argue probably not, because we know that severe B12 deficiency causes irreversible peripheral neuropathy that may lead to paralysis. So we know there's a definitive link between the well-being of the nervous system and vitamin B12. And finally, what is the optimal timing of these therapeutic injections if it is found to truly be an effective treatment for this patient population? Would it be better to begin at the time of diagnosis instead of 2 months later? Should patients with known COVID exposure begin prophylactic B12 supplementation? A thoughtfully designed study with an N greater than 1 would definitely be useful in answering these questions. The scientific community has made enormous gains but I'm hopeful that we'll continue to illuminate much of what we don't know. And with that, I want to thank you all for your attention. I'm happy to take any questions at this time.
Natalie, that was really great. This is Payam speaking. Thanks for the presentation. I just have a question before even Leah comes to moderate for us. I'm curious if we can learn anything from looking at, let's say, the SARS-CoV-1 infection or even some more severe influenza infections. There must be some data about this sort of, neuropathies or neural connections following even recovery from the infection. Have you looked into that?
Yeah, that's a great question. I have not specifically looked into that, but that is definitely something we need to know more about. I know there's a lot of discussion about many different vitamins and other supplementations, not as an antiviral therapeutic, so to speak, but just overall improvement of the morbidity that comes along with these viral infections. I would have to look more into that, and I'm sure there's data out there, and I think that's a great point. Thank you.
I also wonder in this specific case if there is, because there's so much anxiety associated with this particular virus, if that sort of plays into the after effects as well.
Do you mean maybe talking more about the placebo effect here?
I mean, not exactly placebo, because at the same time, I guess there is some really interesting new data showing that some of the cytokines that are implemented in some of the more severe cases of COVID, IL-6, even IL-4, IL-17, are shown to be having effects on memory. So I suppose that's an other pathway that one could look to see if these cytokines are elevated in the patients. Maybe one could make a link there, but
yeah,
it's just a really interesting question. I guess there's a lot of interesting ways one can move forward.
Mm-hmm. We know that B12 is needed for DNA synthesis and specifically for the nervous system myelination of axons. So when you're battling a viral infection, your cells are replicating, our white blood cells are going crazy, and there's a lot of activity. So there is a plausible link there that could be at play here. But yes, we definitely need more investigation.
Thank you so much. I'll let Leah take over.
Maybe this is Eleanor here. Quickly jump in before Leah has. I know she has one question to ask. There are some data that's showing that actually the virus actually targets the endothelial cells in the brain. So and coagulation effects would have an impact on brain function. So I think there's it's a really exciting area, and we're going to see emerging more and more probably brain dysfunctions. So exciting. Anyhow, over to Leah.
Thank you, Eleanor. So one question that we do have in the Q&A section is, have you had any patients with severe PTSD, hallucination, or suicidal thoughts?
Well, fortunately, in the practice that I was rotating at, and Dr. Rodriguez's practice, the population is mostly very elderly. And so once lockdown started in Florida, many of these patients stayed home, and fortunately, we actually didn't have so many cases from our office. The people that did ultimately get it, we were very active with giving oxygen concentrators and also assessing them early on. So we actually didn't have very many patients that got extremely sick or ended up passing away. So I don't have any personal experience with patients that got to that point. Really, the only one was this patient that I'm talking about today. But I know that there is literature and other case reports on exactly what you just described, Leah. And yeah, it's definitely going to be an ongoing problem that we're going to have to really deal with, along with all the other consequences that are going to stay around with this pandemic.
And there's one more question that I think is in regards to the patient you've mentioned, but the question is, have you done a lumbar puncture?
So this patient, yes, like further workup to see maybe there's some underlying neurological pathology is definitely mind. The thing about her is that she was very, very sick with the infection, and this worked. This was a cheap, easily accessible. It's very hard to get B12 toxicity. It's very rare that you get that, and this is working. Now that it's been nearly a year, it'll be a year in May, since the patient has had the sequela, maybe it's time to do more investigation into the nervous system. We have not done a lumbar puncture or maybe like a brain MRI or CT of the brain. I don't know if we'd start at the lumbar puncture. We would need more evidence to see maybe if there's CSF inflammation or something going on there to investigate there. But I think at the 1 year mark, if the patient's still suffering as bad as she is, we would definitely start with further workup, because ultimately it wouldn't change the treatment at this point. Thank you.
Thank you. And how common are neurological complications?
Yeah, it's very common. I was describing this patient, this fogginess, this brain fogginess, and I have been reading it's very common. And unfortunately, the respiratory consequences are not the only thing that we need to consider with patients that get this virus that get a very bad infection. I don't have exact statistics, but it's much more common than you hear about in influenza or in SARS-CoV-1, for example, or the simple respiratory syncytial virus. It's going to be probably a major component of what we're going to have to deal with.
Okay, thank you. And more questions might appear in the Q&A section. So if you just stick around, you can answer those and type them out.
Thanks so much. Thank
Thank
you.
you for your presentation.